let every X-ray request or CT scan request come from the clinician.
Hello guys, thank you very much for tuning in to the HEALTHWING. Have friend to episode stay happy, healthy and strong. Leo for radiographer. Yes, we'll be talking more about the effects, the importance, and more about radiography, things that you ought to know.
Hello, I am Frederick. I'm a radiographer, and welcome to today's forum. We are going to discuss about radiation protection. More so especially from X-ray devices that we apply in our medical hospitals.
What's the importance of an X-ray, or when do people do X-rays?
Well, X-rays are of much beneficial to the patient because they help in diagnosing. And the clinician will always request for an X-ray, and this one assists in management of the patient.
Okay, so what are the effects of the X-ray?
Well, we do have two types of effects, long-term and short-term. Long-term, I'll start with long-term. When you get too much exposed to the radiation, you get long-term, which involves or it entails things to do with the future generation. Maybe let's talk about gonad effects, chromosomal DNA change in the patient. Short term, we'll talk about effects that happen there and then, especially when the radiation is not much prolonged. For example, maybe things like skin cancer, all of sort.
So it's true that cancer inaweza kuwa na scans.
Yeah.
The X-rays.
Yeah, especially when we have repeated too much dose. We talk about dose accumulation of the X-ray. Yes.
Is there a limitation of how many X-rays one should have?
Well, it is not there, because patients will vary. The type of diagnosis that is needed will determine how many X-rays that a patient needs. But we quantify that in terms of dosage. Generally, we have not reached that, because at that stage, that is when we talk about radiotherapy. But for diagnosis, we don't have a certain number of X-rays that need to be taken.
Okay. Not that X-rays can be hazardous at some point. How do you protect your patients against that?
Well, number one, patients are supposed to wear what we call lead gowns. They are special kind of clothes that do protect them from the hazardous X-rays. More so if, let's say for example, you want to do hand and you don't want to expose this patient, you have to, as a radiographer or a radiation worker, you need to protect this other patient, this patient, by putting on a special jacket that's called a lead apron. That's one. Two, we try to reduce the amount of radiation by reducing the cases. For example, avoiding repeats, because the more you do it, the more the dosage accumulates inside the body. Another way of ensuring that we protect them is following the lead standards in any building during construction, so that we protect also the public. The radiation does not leak outside the radiation room. And we also don't have windows in any X-ray room. Ideal X-ray room does not have a window, so that there is no outlet flow of the radiation to the public also. So those are the few ones.
Okay, now that radiation affects the human body, and it can even cause cancer, all those things. What do you advise people when they're coming for like x-ray? Kuna kitu yenye anafaa kuwa amejitayarishia ama kuna venye anafaa kuwa amejitayarisha kija x-ray?
No, there's no specific, but for example, we usually advise ladies of childbearing age to always talk about or to inform the doctor or the clinician about their pregnancy status. Because when you irradiate a lady who is already pregnant, especially during the first trimester, you can affect that, especially for the future generation, by interfering with the during mutation. You can interfere with the DNA. So that is one reason, but there's no specific. The most important is to reduce the amount or the amount of radiation by doing less and less number of exams for a certain patient. Yeah.
Talking about doing less, I know that there's some situations that will force you to do more. Which are these situations?
Maybe when there's an accident and the patient is unconscious, sometimes we might be forced to do almost the whole body, x-ray of the whole body. But then at the end of the day, the benefits of doing an x-ray outweighs the disadvantages, because when somebody is fractured, and maybe for example it's a lady who is already pregnant, when you do cover them, you are trying to assist them. So the benefits outweigh the disadvantages. That's why the x-ray, we usually say the x-ray is good only if all the procedures are followed according to the standards that have been given.
Okay, apart from x-ray equipment, are there any other radiation equipments in the medical field?
Yes. When we talk of x-ray radiation, we talk about ionizing radiation.
Yeah.
And x-ray is one of them, of course. In most of level 4, almost all level 4 hospitals have the x-ray machine. But in addition to that, the CT scan also has the x-ray tubes within it, and it gives more radiation than the x-ray, because a single CT machine has 3 x-ray tubes. So generally a patient will receive more than 3 times compared to when you're doing a CT compared to a normal x-ray. So the dose is higher in CT scan. For other modalities, ultrasound does not need radiation for image production. The same with MRI. So basically, just talk about the X-ray, the CT scan, and even the mammogram. Mammogram also has that. So we try to reduce the amount of radiation while exposing the patient. So in short, in summary, there's the X-ray machine, the CT scan machine, the mammography. There's another one called OPG for dental. That one also has, it also produces a lot of radiation. So those are the majorly 4 main machines that can be or that do release ionizing radiations.
Okay.
Yes.
I think we are concluding this. Thank you very much, Daktari, for joining us. Before we leave, or before we finish the session, what would you tell the patients?
Well, let every request, every X-ray request or CT scan request come from the clinician. Sometimes we have patients who are requesting for themselves, and this one is a major issue. The clinician knows that about the effects and the disadvantages and advantages of doing an X-ray. So in order for us to try and avoid too much or excessive doing of the X-rays to a certain patient or patients, and that one will come handy in assisting the patients in order to reduce the dosage and safeguard the public. Thank you.
Okay, thank you for watching till this part. Continue subscribing. If you've not subscribed, please subscribe. Hit that notification bell. As you've heard, if you're a patient, please stay a patient. Do not go to the hospital and become the doctor. Till next time, Bye.